Nice.
Hello, everybody. Welcome to Birth Control Trendy Tuesdays. I'm Edie, or Iris. I am a rising senior at MIT studying biological engineering, pre-med, just like Dr. Yen was back when she was at MIT. I'm an aspiring physician gynecologist, and I'm here with Dr. Sophia Yen, who is the CEO and co-founder of Pandia Health. Every Tuesday here on Pandia Health's Facebook page, we answer some of the trending or hot topic questions on birth control or periods, I forgot the word, or anything related to female reproductive health. So make sure that if you aren't already signed up to get your birth control delivered with Pandia Health and you have an active prescription, check us out, pandiahealth.com. You can sign up to get your free delivery and automatic refills on your current birth control. And if you don't have a birth control prescription and you live in California, Florida, or Texas, you can sign up to get a virtual doctor's appointment and get your prescription with one of our expert doctors. And yeah, then you get free delivery, and then you don't have to worry about going to the store or grocery, be exposed to COVID right in the comfort of your sofa. Awesome. So if you do sign up, make sure to use the code TRENDING, which is scrolling down here at the bottom, to know that you heard about it from us today. And yeah, the topic for today is just some questions that we found people are asking Google. And we want you to get the knowledge straight from a doctor. So we're answering them right here today. So question number one is, how effective is birth control?
So obviously that depends on what method you choose. So condoms, well, actually, let's just start with, if you don't use anything at all, 85% of people that are using nothing during a year will get pregnant. So over a year, 85% of people using nothing will get pregnant. However, if you use condoms, 13% of people using condoms will get pregnant. And that is the usual use number. There's the perfect number, and then there's the usual use number. And in usual use, 13% of those people that say they're using condoms as their birth control method get pregnant. For the birth control pill, patch, or ring, 7% of people using the pill, patch, or ring will get pregnant. However, research has shown that the ring and the patch are more effective than the pill in general, simply because the ring, you only have to remember it 12 times a year. And the patch, you have to remember 52 times a year, because there's 52 weeks in a year. And then the pill, you have 365 chances a year to mess up. And so there's a slight better difference in efficacy, but right now the numbers are just saying 7% of people who say they are on the pill, patch, ring will get pregnant in a year of using it. What's impressive is that the IUD with hormone and the implant, it's 1 in 1,000 people that will get pregnant in a year of using it. And the perfect and the theoretical use are the same, because it's in your body and you don't have to think about it. And the IUD lasts with hormone 5 to 7 years, and the implant lasts 3 years.
Yeah.
And then I forgot to mention on the last one, the shot, which is also very popular. The shot is 4% of people using the shot get pregnant. And that's because you have to come in every 12 weeks or find someone to inject you every 12 weeks. So if you have work or something, you can't get there, then that one could always see as a barrier as well.
Yeah, it's crazy how much human,
error.
Mistakes, human error plays into the effectiveness of your birth control, like 7% almost.
Yeah, so the difference with the pill, the patch, the ring, 7% in usual use, but 3 out of 1,000 in perfect use. So in research studies where we're like, and somebody's following you, then it's 3 out of 1,000. But if we just put you on it and we survey people, then it's 7 out of 100. So that's like a 10-fold or even 20-fold difference just on human error. And then the other one I like to cite is tubal ligation. So if you chop a woman's tubes off, it's 5 out of 1,000 chance. So it's crazy that the IUD with hormone and the implant are 5 times better than chop, snip, burn, and that you do have a 5 out of 1,000 chance of getting pregnant with tubal ligation. Vasectomy is actually, the other two methods are actually better than the vasectomy. So vasectomy is 1.5 out of 1,000, whereas the implant and the IUD is 1 out of 1,000. So I didn't realize they beat vasectomy. I always thought vasectomy always won. Oh, I guess on the theoretical, on the perfect, oddly enough, it's 1 out of 1,000, but in reality, it's 0.15. I don't understand that. Maybe if they're really, really anal about the surgery, but if they're careless, it's 1.5.
That's crazy. I actually saw an episode of I didn't know I was pregnant, and that's the first time, which was tubal ligation had failed. I'm like, that's the first time I found out that a tubal ligation wasn't the best.
100%.
Yeah.
So. It's the second, third best, again, IUD with hormone and implant. And that's the thing is, as the only doctor-founded company in birth control delivery, we will always tell you what's best for your health, even if it doesn't help our bottom line, because we will make money, but we don't have to make it off pushing stuff on you that you don't need or that isn't best for your health.
Yeah. So thank you for having your patients first. Yes. Cool. So the next question that we have is, how does birth control work?
Yes. So again, depends on the method. If you are using the IUD with hormone, the implant, or the shot, these are all progesterone only methods. And so I'm starting with the best and working our way down. And with those methods, progesterone only, what it does is you have the lining of your endometrium or your uterus. Ooh, prop. You have your uterus and you have your lining, and it grows to, let's say, a level of 10 to support a baby. However, if you're on a progesterone only method with no estrogen, it grows to a level of 1 or maybe 0.5. And so it's very, very thin. And so if the egg and sperm were to hook up, it would have nowhere to stick, nowhere to grow, no way to support a baby. That's number one. Number two, down here, here's your vagina and here's your cervix, the entrance to your uterus. There's cervical mucus, and that mucus went once a cycle for a couple days. When the egg pops out, it becomes runny, and you can run the sperm through. It's like shoots the sperm into your uterus. However, the rest of the time, it's like cement. Bonk. The sperm tries to get in there. Bonk. Bonk, 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 bonk. And so the progestation tells your body that you're pregnant. And so it's like, I need to keep this sealed. I'm growing something in here for 9 months. I don't want anything in here. And so you got cement here. You've got a wall of cervical mucus. And so that is a huge method of blocking the sperm from getting up in here. So that's how the progesterone only methods work. For the estrogen methods, they have an added bonus. So the estrogen method tells your body you're pregnant, and somehow the estrogen methods are better at telling the ovary, she's pregnant, don't release an egg. The progesterone only does that in about 30% of the time, but the estrogen progesterone is much more. And so that's why I say when you're trying to skip periods, a progesterone only method, 30% of the time will work. But with the pills, we have like 40 different pills we can try, and the estrogen component. So if you're a control freak and you want no chance of random bleeds, then the pill is a good way to go. Certainly the ring, if it gets you there, but the ring only comes in one flavor, or actually now there's 2 flavors. The patch only comes in one flavor, but if you need other flavors or other doses, then the pill gives you a lot more options to work with. But the pill you have to take every single day, so 365 days that you could mess up.
Yeah. Is the estrogen combination pills the ones that you said that stop your period or are more likely to stop your period?
Yes. Anything with estrogen is more likely to stop your period because estrogen stops bleeding. It's what we use if somebody's bleeding out after giving birth. We give them a dose of estrogen. Or if somebody comes in and it's their first period and they have a bleeding disorder and they're bleeding like stink, and we're desperate, we'll give them IV estrogen. We'll try some birth control pills first, actually, to stop it. And if that doesn't work, then we'll go to the IV estrogen to stop their bleeding. So that's why estrogen is a greater risk of blood clots. And so if you're a smoker or 35, which also puts you at risk of blood clots, then we do not prescribe any estrogen-containing method because of blood clots. So birth control is all about be afraid of the blood clots. And so the estrogen methods, again, block the egg from coming out, thin the endometrium. I don't think as well as the progesterone only. Like, so I would envision instead of 10, you go down to 2 instead of 1 or 0.5. But this is just me arbitrarily making up numbers. But the research has shown when you look at it by ultrasound. I just don't know the exact numbers off my top of my head. And then the cervical mucus plug also works in the estrogen and progesterone methods because it has both the estrogen and the progesterone.
Awesome. So it uses multiple mechanisms that your body already has in place and kind of like hijacks it to make sure that it thinks it's pregnant.
Yes. And so that is really, I want people to get it in their head. Progesterone is the hormone of pregnancy. And so if it tells your body you're pregnant, your body's like, well, why would I pop out an egg? Why would I let anything into the uterus, which is supposedly growing something for 9 months? You want to keep that sterile and clean and safe. You don't want any new foreign bodies, and you certainly don't want, it would be crazy to have 2 babies at different times. You know what I mean? Like one is 1 month old, one is 3 months old, and it's growing.
Yeah. So thankfully with science, we've taken good care to like figure out how that works, and we've gotten it up to like 99%. Oftentimes if you use it religiously, which is great.
Yes.
Cool. So the next question is, how much is birth control?
Again, depends on the method. So for the condom, could be $1 a condom, depending what brand, depending how many you're buying. Usually 50 cents. If you go to Costco and you're buying it in bulk, then certainly a lot cheaper. Or if you can buy it in bulk in general, just one random tip, condomdepot.com. Love that website for discreet condoms coming to your door, but mainly I love it because they have a he said, she said. He gave it like a B plus. She gave it an A minus. And so at my teen clinic at Stanford, we pride ourselves on having the top 3 condoms because we figure if it feels good, you're more likely to use it without a higher breakage. And so go on that website and check it out and see which ones you like. And someday in the future, Pandia Health will offer condoms as well. And we will offer the best because we want you to be most likely to use it. The cost for the pills for Pandia Health, it's $15 per pack. And just so people know, most packs have 21 days, 3 weeks of active pills and 1 week of placebo/sugar. So if you're going to skip the bleed, then it's 21 days in each pack that are actually working for you. If you're going to choose to bleed, then you have 28 days, or we generally suggest you shorten the bleeding to 5 days because the research has shown there might be some escape ovulation on day 6 or 7. So that would then make it 26 days of medication for you. However, there are packs that have 84 days of active pills and 7 days of sugar or placebo. And that's $45 or $50 depending on shipping, handling, or whatever the price is. The unfortunate thing is that is one with a different hormone that might have more side effects. So I always ask people, do you want to try this one? Which most people do great on. But if it were me or my daughter and I had the extra money, I would go with this one because this one in general is known for having less side effects. But maybe you won't notice side effects or, again, different people respond differently. And many people have done fine with the 84/7 one. It's cheaper and it's, better bang for buck. If you are going for a name brand, and know that 95% of birth control is generic, not name brand, but the name brands are Yaz, Yasmin, Seasonal, and some other weird ones, but that's about it. But there is generic Yaz, there is generic Yasmin, and the FDA requires that they have the same exact active ingredients and the same exact dosage. The only difference between brand and generic is that the generic came after the brand. The brand came first and they got a head start and they got to charge crazy money. And then the generic came after, and this one may have different inactive ingredients. So the color or the filler. So this one may be blue and this one may be green, but the active ingredients are the same dose and the same active ingredients. So 95% of birth control is generic. So I've had people come in and go, I want Ciada, I want Estoria, I want Camrese, I want this. These are all generic. I'd really like to create an app that you put in your birth control and then you bet whether it's generic or brand. And I'm betting 95% of the time it's generic and you think it's brand, but it's not. It is a brand, but it's a generic brand. And so the generic brands, again, $15 per 28 pills or 21 active pills, which is 50 cents a day. 3-pack minimum. If you buy 1 pack, it's $20 to cover our shipping, handling, and overhead. And then the name brands can cost $200, $50. It just depends on the specific brand and whether you have a coupon for them for your local pharmacy.
And what about other forms of birth control?
Good question. So the ring and the patch can cost $150 to $200. There's now a 1-year ring, which is a very interesting thing. And that one is like $2,000. So under the Affordable Care Act, if your employer is not religious or your employer has not opted out of covering birth control, there should be no copay, no deductible. So free, as long as you have insurance and as long as you're not demanding brand when the insurance only covers generic.
And that's for the pill, for patch, for
the ring, any FDA approved method. And what's even cooler is it covers emergency contraception, the prescription, and the over-the-counter. And if you all want to learn more about that, Google Pandia Health, YouTube, emergency contraception, because we recommend the prescription emergency contraception, because Plan B and its generics, if your body mass index is 26 or greater, is as good as water, meaning it doesn't work. So if check your BMI, if it's 26 or greater, you want the prescription emergency contraception, but also the prescription emergency contraception called Ella works better at every time period compared to Plan B and its generics. And if it were me or my daughter that was sexually assaulted or any chance of pregnancy, I would want the lowest chance of pregnancy possible.
Yeah, awesome. Daisy asks in the chat, can you still experience period symptoms without actually bleeding? Because I think you mentioned the 84 pill pack where you don't get your period.
Yeah. So great question. Every woman is different. And I always go back to my MIT dorm room. One woman every 28 days. Another woman every 35 days, me. Another woman every 90 days, polycystic ovarian syndrome. Google Pandia Health, PCOS, if you want to learn about that. And so you can imagine this woman already isn't popping out an egg every month. Easy. No problems, no symptoms. 35-day, probably doable. Every 28 days, sometimes difficult to take over, crazy fertile woman, and most likely the one to fail any method, not any method, but many methods. Those are the ones I found. When they fail, I was like, are you a 28-day lady? And she's like, yes, I am. And I was like, very strong internal want to get pregnant kind of body. And so that woman, even though we may be able to turn off the bleeding, might still have a little of those symptoms out there, but it's, again, each person is different because the pills are just not generic, but they're made for the same level, right? And you can imagine if you're 70 kilos, 100 kilos versus 50 kilos, it's going to be different. And we're all giving you a 30 microgram estrogen pill. So, in the future, we should, in pediatrics, we always do everything milligrams per kilogram. But once you're an adult, we treat you all the same. And that works for 95% of the people. But for 5% of the people who are skinnier or heavier, that's going to be a different experience for you. In general, if you're heavier, I think you're going to have a harder time because it wasn't dosed for you when they created the medication. And there just isn't enough medicine to cover what it's supposed to cover.
I think whoever is developing birth control should go into precision medicine since there's so many, differences body to body, and we're just slapping on the same solution for everything. Cool. Awesome. The last question that I had was how much is Yaz birth control? But I think you mentioned, and we also in the last live, we went on goodrx.com to find out how much Yaz was. And we found that without a discount, it was $200 and then it was $40 with the discount, but still that doesn't compare it's much more expensive.
So it was $49.
Yeah.
And I kept slipping in my Spanish between 40 and 50, but it's 49, 55 or 49 plus some cents with a coupon, and that coupon usually only works the first time they catch you and trap you, and then or it's possible it could work each time. I don't know, you have to go check their website and check the pharmacy, but the pharmacy certainly is not going to be happy if it costs them $200 and you have a coupon for $50 because they're going to have to eat $150. Regardless, you shouldn't care, but you should just get the best possible price. But I would go with the generic. Again, 95% of people do fine on generic Yasmin, generic Yaz. And then we wanted to do a random education that Yasmin has the exact same progesterone as Yaz, the exact same dose as Yaz, I believe. The only difference is the estrogen. And so Yaz has 20 micrograms of estrogen. Yasmin has 30 micrograms of estrogen. And as an adolescent medicine, young adult specialist, and those of us in adolescent medicine at Stanford, we don't recommend less than 30 micrograms of estrogen for anybody less than 30, because for your bone health, you're putting on your calcium, filling your calcium bank from 15 to 30. And if you don't have enough estrogen, they've found you have a lower bone mineral density if you use a 20 microgram pill. So you want Yasmin, which has 30 mics. And a good way to remember it, as you notice, is Yasmin is longer than Yaz. So Yaz is small and 20 microgram, and Yasmin is 30 microgram. The other subtlety is that Yasmin has 24 active days and 4 sugar pills, and Yasmin has 21 active pills and 7 placebo pills. So that's just a subtle difference, but you can get them both generic for $15 a pack or 50 cents a day with Pandia Health. If you don't have insurance. If you have insurance, it's free. If you don't have an employer that's evil.
So yeah, take advantage of your health insurance, get free birth control, and then free delivery with Pandia Health. Don't even have to think about it. Yeah, I would love for everything in life to be that simple. Cool.
I know we're looking at menopause, and I'm shocked that they don't cover menopause medications, all the insurances necessarily. And I'm also shocked that menopause is supposedly 1/4 or even like 1/10 the dose of birth control pills, but costs 10 times as much. So if you had to pay cash for the birth control pill for menopause, it's $130 to $150. There are no generics. And when I wish you could just cut the pill into a 1/10 and take it, right?
Yeah.
So watch out on the other side. We need to fight for that.
Yeah. Make sure that we have just as much healthcare coverage in our later years.
Yes.
Awesome. Well, thank you so much, Dr. Yen, for answering our questions. And thank you all for tuning in. Make sure to tune in next Tuesday. Every Tuesday, we cover trendy topics. And check out Pandia Health's website. We, as I mentioned, we deliver birth control, automatic refills, and we have YouTube, Facebook, Instagram, where we post educational content and just like cool, inspirational female content that get yourself informed. And because Pandia Health is women-founded, women-led, doctor-led, it's one of our important missions to empower women and make sure that they have they can make the decision of when to have children if they want to. Cool. So thank you again for joining us, Dr. Yen, and everybody else. Make sure to sign up for our services at Pandia Health and use the code that's down below. We'll see you guys next week.
Thanks, everybody.
Bye.